Hello, everyone. It is October 11th. We're 11 days into Breast Cancer Awareness Month. A lot of you, I don't know if you're following my journey or not. It's been 10 months since I've been diagnosed. I was diagnosed December 2019. I had my double mastectomy January 6th, was it? Yeah, it was January 6th, 2020. How can I forget that date? I should be ashamed of myself. Since then, I want to say, I had the double mastectomy in January 2020. I had my exchange surgery April 13th, 2020, where they took my tissue expanders out and they put my gelish implants in. I had my nipples done where they made nipples from just using skin. They cut skin and they tied it up and sutured it and made nipples on August 4th. And I'm getting my nipple repigmentation where they're going to tattoo the areola on October 23rd. And after that, I go back and I see my breast surgeon in February to do final construction, fixing some areas. Um, there has been a concern of mine that is very weird. In my right breast, sometimes when I lift my arm up, it does this kind of weird dent thing. I'm going to try and show you guys because it's very weird. I'm not really exposing myself like that. But if you can see that muscle, I'm not sure if you guys can see that, but yeah, that muscle, it kind of turns in there a little bit like that. So that's it's very strange. You can definitely tell that there's no breast tissue there because it's not supposed to cave in like that. So I'm going to see if he can take some more fat from my stomach and put it into my breast. That's what they did in April as well. When he did my exchange surgery, he did some liposuction and he took some fat from my stomach and put it into my breast to give it more of that contour, realistic look. That's where you see this. That's this cleavage look that he called it. Give it that nice cleavage look. Um, so that's basically how my journey have been. Since then, I did test positive for estrogen receptor, which means that the cancer will come back. And I didn't have to do chemotherapy as far as where they have to do the port or radiation, but I am on chemotherapy pills called tamoxifen. Tamoxifen, that's the chemotherapy hormone treatment that I do. I take those pills every day. They have 10 milligrams and 20 milligrams. Unfortunately, I'm on the 20 milligrams and I'm going to be on that for 20 milligrams for 5 years. Minimum 5 years, max is 10. Hopefully, I'm on there for 5 years because the side effects is terrible. And I was placed on that 2 months after my double mastectomy. I started that in March. I was dealing with the side effects fine. It kind of, in a way, I'm not gonna lie. And when I moved here to Georgia, I seen my oncologist. Then she placed me on something called Lupron, where I go to the chemo center every once a month and I get an injection that topped the cake. That's double the side effects. It's terrible. It's really terrible. Um, and I have to do that the same amount of time as the tamoxifen. However, due to the fact that I am 33 and I'm still, I don't have no kids or anything like that, I am still trying to get pregnant. I do apologize. My braids are in my way. I want you guys to see my beautiful face. And so the story with that is that I have an ovulation disorder, which causes me to be infertile. So I have to get off of the Lupron for at least 3 months, let it be out of my system, then go on to fertility medicine, which is called Clomid, to see if I can try and get pregnant. Once I am pregnant, I will, have my child. After I have my child, I will go back on all of my chemotherapy medicine. I will go back on the tamoxifen. I will go back on the Lupron. I do apologize. My computer turned off. I will go back on the Lupron, and yeah, so I'm gonna just have one child, because it is very risky due to the fact that I also have a brain tumor and an aneurysm and autoimmune disease. So it is a risky situation. If that is not possible, I am willing to adopt or have a surrogate. Adoption most likely would be my case, due to the fact that I was also a foster child. So I definitely am open for that, most definitely. So that has been my journey. I am open to answering any type of questions that anyone have. I am the youngest that I've seen so far to be diagnosed with breast cancer. In my doctor's office that have seen, I have met some of my pink sisters around my age. I know there's one young lady, she's about 36, 37, and she just was recently diagnosed this year as well. So this is something that, we need to be cautious about. We hear a lot of stories about, oh, you don't need to get a mammogram until such and such age. But ladies, get your tatas checked, please. I nearly missed my diagnosis because my rheumatologist thought that it was heartburn and gave me acid reflux medicine called omeprazole. And I was having pain for months. It was like a sharp radiating pain that was in my left breast. Come to find out, my left breast had one big tumor and then 6 small tumors around it. She called it a solar system. And then my right breast had 2 tumors. One was actually a fibrotic cyst, and then one was a benign tumor. But due to the fact that I had evasive ductal carcinoma, it was going to eventually turn into 2 tumors again. So, off with the breasts, she said. Both breasts, cut them off. And I was able to do breast reconstruction because I am at that age. I'm young, single, not married, no kids or anything like that. So I do think Cedar Crest Hospital, they are amazing. Lehigh Valley in Pennsylvania, you guys gave me a second chance at life. You guys saved my life. I was a stage 1. I'm in treatment for 5 years. It's going to be a rough 5 years, but I'm willing to fight. I had my weak moments this weekend. I was completely sick, throwing up, using the bathroom nonstop, become dizzy. It's a rough road, but when I look back on it, when I look back on 2 days ago, just there's a sweat coming down my face and my eyes were completely red, like I was completely flushed. I was like, is this what death feels like? Like, am I gonna die? Like, I honestly thought that I was gonna die. But I had strength. Like, I don't know where that strength came from, to be honest with you, but I had it and I made it through. And I just want all of my pink sisters to know that you're not alone. We're not alone. We're here together with each other from miles and miles away. I know people from United Kingdom, London, Washington, Canada, Virginia, California, and I'm here in Georgia. We're here together, and we can make it through anything. I mean, from all my pink sisters sharing advice about medicine, what to do, what to take, I thank you. And my advice to everyone else, I'm here for you no matter what. And I thank you guys. I'm your breast cancer advocate. A lot of people's like, you're that voice. You're very transparent, which I am. I'm very transparent. A lot of people was like, are you sure you want to be sharing that much information? And I'm like, yeah, because when I was first diagnosed, I really didn't know that much information, and I tried to look for information. You can't really find that much where people are open and transparent about certain things, and especially when it comes to graphics and want to show things. Yeah, as you guys can see in some of my previous videos, I showed a lot of stuff. But when I got my nipples done, I couldn't really show anything anymore. So, But if I'm sorry, my computer turned off again. Bear with me one quick second. I am back. But for those of you that do want to see some pictures, you can privately message me, and I'm very open. I don't mind showing you pictures of before, after, what it looks like. And like I said, I'm going to be getting the areola nipple repigmentation on the 23rd. I'm going to be taking pictures of before, after the process, the healing process, and everything like that. Unfortunately, insurance does not pay for that, so I do have to pay out of pocket for that, and that's a couple of $100s. Yeah, so that's the only downside about it. But other than that, insurance did pay for everything else. If anyone, is looking for assistance as far as like utilities or rent payment, they do have different foundations. There's the American Cancer Society. There's the Breast Cancer Foundation. They have one here in Atlanta. There's the Pink Fund. And there's a couple of foundations. I have them written down. If anyone needs any resources, please feel free to comment or privately message me. I'll be happy to share my resources with you. Once again, stay strong, Pink Sisters. And anyone, if you have any questions, please feel free to email me. My contact information will be below. Thank you. God bless.